Good afternoon, everyone, and thank you for joining us for this week's National Bleeding Disorders Foundation, formerly National Hemophilia Foundation, Wednesday webinar. My name is Fiona Robinson, and I'm the series host. In today's webinar, we will hear about the Women, Girls, and People with the Potential to Menstruate Summit overview and discover the roadmap for change, and we will invite you to contribute to it via the open comment forum. This webinar is being recorded and will be available to the community beginning on Friday, December 15th. We encourage you to ask any questions you may have today. You can ask your question by using the Q&A feature at the bottom of your screen at any time. We will monitor these questions as they come in, and following the initial presentations and discussion, our guests are looking forward to answering your questions. Today, we are joined by a whole panel of experts who attended the Women, Girls, and People with the Potential to Menstruate Summit. Kate Namaker is the Vice President of Education at the National Bleeding Disorders Foundation. Nikki Angelis is a lived experience expert with von Willebrand disease. Susan Lurch is the Executive Director of the Hemophilia Foundation of Michigan. And Dr. Nathan Cannell is a hematologist, Chief of Medicine at Brigham and Women's Faulkner Hospital, and the Associate Director of the Boston Hemophilia Center. I'd like to thank all of our expert guests for joining us today, and I will turn things over now to Kate to get us started.
Thanks so much, Fiona. We are really excited to be here and share after all these months, kind of what happened at the summit and what are our outcomes and next steps. So with that, this is our mission. Many of you Wednesday webinar regulars have seen this every single week, and yet I think it's really important. This truly helped drive this summit specifically. There's nothing in our mission here that says it's only, that we're dedicated to finding cures only for a certain group of people with bleeding or blood disorders, right? This is truly NBDF being inclusive, making sure that various different parts of our community and their specific needs can have a place at the table and can start to be addressed. The other piece I'll just highlight is that we always say that we do this to address and prevent complications from these disorders through research, education, and advocacy. And though all of those were addressed in this summit, this isn't like, let's just hit this from one angle. This is truly like, how do we all come together across all of these different venues and different key areas to move the needle forward? So very exciting stuff. All right, you've already heard this acronym once or twice. Fiona mentioned WGPPM. We had it in the title. I wanted to take a moment and really describe not just what it is. You can see it's women, girls, and people who have or had the potential to menstruate, but the why behind it. So we use this acronym. We chose it to be inclusive across ages, women and girls, knowing that there are unique challenges that vary through the lifespan, but also to be inclusive of the needs and experiences of gender diverse people who were assigned female at birth, but now have a different gender identity. So there's more to it though. While the term is framed around menstruation, a lot of people in all of our conversations really fixate like people who have or had the potential to menstruate, that it's not everybody that this is trying to be inclusive of actually currently does menstruate. So regardless of gender identity, some people have had hysterectomies, others have had their periods suppressed through hormone therapy or other approaches, right? Others have gone through menopause. And again, we wanted to be inclusive of that entire spectrum of experiences that fall underneath this. However, it is that potential that was really the unifying across all of them, that at some point there was that potential to menstruate, whether maybe they haven't even had their first period yet. In addition, we want to acknowledge that bleeding for WGPPM is actually not just about menstruation, right? So even though that word is in here, of course, there's joint bleeds. There's so much other pieces to this that is beyond just menstrual bleeding, even though, of course, we talked a lot about heavy menstrual bleeding at the summit. But we really wanted to create that umbrella term that could be inclusive to all of that and make sure we could address all of that to improve health outcomes. So why did we do this? What were we trying to get out of it? We really had a few key objectives. We wanted to raise awareness of current local, regional, and national initiatives for WGPPM. We definitely know there's quite a lot going on in the community right now. This is amazing that there actually are a lot of different things happening, but are we all coordinated? Are we all communicating? Are we all sitting at the same table every now and then to share notes, right? So that was one big piece of it, to make sure all of the different parts of the community were talking to each other. We also wanted to better understand the key barriers and facilitators of access to diagnosis, treatment, and care for WGPPM, really laying out the bigger picture issues. And then within that, prioritize, right? And that's always the challenging step. And we actually invite you all to be part of that. But we really started with prioritizing and mapping out steps toward improvement in diagnosis and treatment and care for WGPPM. And so that was a little bit started at the summit, but really is going to continue on. And part of the way we're doing that is that we've produced this white paper. It is officially public on our website. And I know at some point, Fiona's going to throw the link in the chat for those of you who are watching in the Zoom. And if not, it is available on our website under educational programs and women. You'll be able to see all of it. And, this was to really make sure we could align strategic direction, focus, and have these activities really be much more in alignment to better support WGPPM across the country. So, we were able to have, and you'll see on the next slide, about 50 people at the summit. And we know that that wasn't enough, right? If anything, our dream would have been to have so many more, all of you who are on today, plus many, many more who you work with, your peers, really be at the table to be part of this conversation. But, resources are always limited in the nonprofit world. And so we had to be a little bit strategic about it. But that is why we invite all of you through an open comment process to review what we started. Right? It is really a start to an ongoing conversation. And so there's an open comment survey on our website where you can actually read the full paper, you can read the executive summary, and we really invite additional voices to participate through that. I checked right before this call today, right before this meeting, and I think we had 12 people who have filled it out. So I know that there are a lot more than 12 people who work with or identify as a woman, girl with potential to menstruate that have a lot of thoughts on this very issue and how we as a community can do better and continue this work. So we really do invite all of you to join us in that. So a little bit more on the summit. We had 50 stakeholder participants, as I mentioned, and it was truly intentional to be across the wide range of different types of perspectives. So our lived experience experts, which is another name we'll call it, you'll hear us say the word LEAS, and it is really our patients, our family support network that are so critical. That view needs to be central and first, right? And so we were so fortunate to have such an amazing group of lived experience experts at the summit who did videos, who shared in panels, and really throughout, we ensured that we were centering those experiences by playing these videos, reminding people of these stories. This is why we're doing this work. Hematologists were at the table, nurses, physical therapists, social workers, and really importantly, having healthcare providers that aren't in hematology, that might be the first person you go see if you have signs and symptoms of a bleeding disorder. Of course, our network of chapters and member organizations across the country, really important. You guys are already doing so much of this kind of work. How do we do this together? What are some ideas we can share with each other? As well as national and international organizations, federal partners, and our pharmaceutical partners. So we really had a lot of different voices at the table. And it was a working summit. As you can see, 1.5-day collaborative working summit. We went by first names. Everybody at the summit, everybody's on the same playing field, all together, no matter how many years of experience you've had, living with this condition or, was studying this or whatever your role might be. And we were all around a table together in small breakout rooms, doing work, ideating, brainstorming. And it was really not just us talking at each other. It was collaborating together. So where did we go from there? So out of this, we, it was a little hard. As you can see, we have 10 priorities here that came from this. It wasn't like we have 5 because there's so much work to be done. Again, a lot of this, there's already been some progress forward, which is amazing. But we really tried to hone this to some, key areas. Some have a little bit of overlap, but I'll just quickly go through them. And you can get a lot more detail of all of the specifics in the white paper, of course. Improving awareness and education across various different audiences, from healthcare providers to WGPPM themselves to the general public, all of that, right, will really help. Overcoming outdated and harmful healthcare provider approaches. Really a key thing that came up is like, just believe me, just listen and believe me as a patient, right? And so how can we start to address some of that? Increasing interdisciplinary collaboration. That's why we brought so many different players to the table, and that really needs to continue. Creating a clear path to diagnosis. There's a lot of steps in there that aren't as seamless as we all would like, right? And that is evidenced by the data. There's various different numbers, but right, 16 years on average from first symptoms to diagnosis. There's different studies that have slightly different numbers, but this is obviously an area we all know we can do better. Ensuring access to appropriate treatment, developing standards and guidelines around that, filling research gaps, being able to make sure their women are not only have a place in research and clinical trials and other types of research, but are actively part of the planning and shaping of that research. It was a lot of really good conversation around that. Overcoming stigma, particularly around periods, right? Because that often is why people don't talk about their symptoms, and that's a societal challenge, but can we all play a part? And encouraging self-advocacy on the part of the patient, where they really can have, feel empowered to go through this process, which isn't always as streamlined as we would like. And clarification of nomenclature that is continuing to evolve, but this comes up a lot around, are you a carrier? Do you actually have the diagnosis? All of these things, it was all discussed. And so those are areas we want to continue to do the work. Now, what does that actually look like? So these next 2 slides, I'm not going to read through every single one. This will be my little hook and teaser to get you all to go read the actual, white paper. The executive summary is a little shorter. It's only 2 pages. But these were some potential action steps. I think this is where we were hoping to have more time to prioritize within these. This is where we'd love community input into prioritizing these, as well as what else wasn't here. We had a day and a half, right? It really wasn't that much time to dive in fully in depth and go through like a process to fully hone down to what all the next steps would be. Luckily, this wasn't just an NBDF thing, right? We may have been the convener, but we had so many key partners at the table that this work will come from all of us, different folks doing different pieces of that. And that's what's really important here. So I'll just pick a few to give you a highlight. Using best practices to sort of have a gold standard of bleeding disorder clinics. What would that look like? How do people find them? And that was an idea from one of the groups, only for one of the other groups at the summit to be like, there's a group already doing this. The Foundation for Women and Girls with Blood Disorders already has some standards for clinical practice for this. So like, how are we spreading the word about that? How can we then all partner with each other? So that's one example. Another one is potentially to create a registry, right? Garner information on clinical studies and research being undertaken in WGPPM and create a registry specific to this so that people can find this information more quickly. Those were a couple of the ideas. There's a whole other slide of them, right? So how do we get more funding, building a lived experience expert speaker bank so that those, folks can go and share their stories and be out in the community, ensuring better access to care and treatment. So many different types of ideas, which is really, really important. So I'll just reiterate, these are potential action ideas. It wasn't like, hey, you're doing this and this group's doing that. We didn't get that far. But the idea is that this isn't just for one organization or one person to take the lead on, but for the overall community with so many different stakeholders to start to figure out ways, how can we do this together? How can we align and coordinate versus duplicate? So we're very excited about that piece of it because it's really important. And then finally, I'll just say, this is the group. These are the 50 people that were in the room actually doing this work together. And I want to close with just reminding everybody about this open comment period that goes through the end of January, but with a few quotes, because again, this entire summit was driven by our lived experience experts, and I would be remiss not to open or close with some quotes and hearing it directly from these women. So women need to be believed when they say that they are having a bleed, despite what our levels say. We are trusted with our sons' bodies, but not our own. And we're all in this together, and we will work as a team to better our community and make sure that every individual with a bleeding disorder gets the help they need. So a lot to think about, a lot to process. We, again, invite you to go on our website and read the summit details in full and really share your voice and your thoughts on priorities in that open comment. And with that, We're actually very, very excited that we have some of our stakeholders who are at the meeting here today to give their take on it as well. So we're going to hop over into some panel discussion. All right, so thank you, Nikki and Sue and Nathan, for being on. We're really happy that you are back. We put you into a lot of work, right? Those day and a half together of really thinking critically about how we all serve this community together. So with that, I would love to just start off with a couple of questions. And the first is, I'd love for each of you to just give a quick introduction of yourself so the community can get to know you. I know Fiona, sort of read off your titles, but would love for you to share how you are involved with WGPPM locally or nationally. And Sue, why don't you go first?
Sure. Thanks, Kate. I'm Sue Lurch with the Hemophilia Foundation of Michigan, where I serve as the executive director, and I'm also the Great Lakes Regional Director for the HTCs in Michigan, Indiana, and Ohio. And we decided 6 years ago, well, actually, we decided 8 years ago to start offering a program for women or folks with the potential to menstruate. And it took us a couple years to get funding, and we had our sixth conference this October. It was pretty amazing. We had 179 attendees. I think 139 were in person, and the others were virtual. And we had folks from 36 states and a couple people from Puerto Rico that joined us. One of the things that we did this year was really look at where we were and where we are now, which we have a long way to go, but we really have made some strides. So that's our engagement here in working with NBDF and the Women's Foundation and others to provide education and support, along with a lot of medical professionals who are engaged with this conference as well. Thank you. Thanks, Kate.
Yeah, thanks for being here. Nikki, I'm going to have you go next.
Yes, everyone in the community knows me as Nikki. I live in New York, Long Island, but I grew up in the city. I am associated with the New York City Hemophilia Foundation, the chapter, sorry. I've been associated with the National Bleeding Disorders Foundation for a long time. I came in within, I believe, 5 years. And I came into the community with a heck of a story, and the community has been amazing in guiding me. At every single community event that I have attended, I have had questions. I have had amazing guidance. I have so many resources, all the way from physicians to nurses to even community members. So I have such a huge heart, and I have such a great mindset and passion to extend the information and the resources in regards to women with the ability to menstruate, and let alone just living with von Willebrand disease. So that is my passion, and that is why I'm here. It's not just the ability to menstruate, whether I can or cannot, but it's also living with a bleeding disorder in general.
Absolutely. Thanks so much for being here, Nikki. Last but not least, Nathan.
Hi, everyone. My name is Nathan Cannell. As Fiona mentioned earlier, I'm a hematologist at the Brigham and Women's and Harvard Medical School in Boston, where I'm the associate director of the Boston Hemophilia Center. A lot of people in the bleeding disorders community know me for my work on the von Willebrand guidelines that I co-chaired with Veronica Flood, Paula James, and Reem Mustafa. And it was a multi-organizational effort with the American Society of Hematology, the International Society on Thrombosis and Hemostasis, the National Bleeding Disorders Foundation, and the World Federation of Hemophilia. And I have definitely been involved with it both locally. Part of my work was actually in our own hospital system to help create a women's hematology clinic to complement our pediatric counterparts that my colleague, Dr. Stacy Croto at Boston Children's, had created. And so a lot of my work has been around trying to improve care for those living with VWD And as we know, it's inherited equally by all genders and sexes, but it disproportionately affects individuals assigned female at birth because of the impacts on menstruation and childbirth. And so that's been my big focus over the last 10 years of my career. And I'm really excited to have been part of this summit.
Well, that was a perfect segue, actually, into my first question to all of you, which is, why did you feel it was important to attend the summit? Obviously, we did invitations, so we reached out to you and we hoped you would say yes. But what made you want to actually show up and be part of this? Nikki, we'll start with you.
Yes, so everyone knows me. My story went viral and crazy when I came into the community because when I was told I had this disease and as I grew older with the disease, it was told to me that I had to make a decision of having to have a hysterectomy versus having to have a child just because of my menstrual cycle. So attending this summit was very, very important to me because it was time to innovate and educate, because it was time to make a decision of my own, of making sure that everyone, whether I lived in the city, whether I lived in the suburbs, no matter where I lived, whether an HTC was available to me or not, that an option was not going to be relayed to me no matter what. It needed to come from me. It needed to come from education about living with von Willebrand disease or just a bleeding disorder in general. I just was tired of having to make a decision based off of what they thought was correct rather than what was coming from me. So just because my menstrual cycle was a problem for them doesn't mean that it was just changing my life to make them, it was easier for them to give me an option to make their lives easier for me to stop complaining. But imagine how my life was going to change based off of their decisions so quickly, so early on at 21, I think it was when they told me this. So this was very, very important to me because not only did this happen at age 21, but I am now newly 31. And here I am presented with the same story and the same options. So obviously there is still room to improve.
Yes, thank you so much. And I'm glad you mentioned that you've shared your story. Many of our lived experience experts were willing to share their story, and many of those videos, so you can hear it directly from them, are actually also on our website, so you can hear more of that story. But that came up consistently throughout around just believe me, understand where I'm at, understanding the choices that I'm trying to help me on that journey of trying to assess this versus here's the option, that's it, kind of a thing. So those were definitely consistent themes throughout the summit from our LEEs. So thank you so much. I appreciate that. How about you, Sue? Why did you feel it was important to be at the summit?
Well, part of it, so the program that we offer is specifically for women who are living with hemophilia. So we do a separate conference that's specific to VWD, but because of the terminology of carrier, that was a big part of our decision to kind of take a deeper look at how women were affected by hemophilia directly themselves, living with this bleeding disorder that was really not acknowledged. And so we started the program specifically with women with hemophilia A and B, or who were carriers but having symptoms. And so I feel like it is so significant that these women are, or these individuals who have the potential to menstruate or have menstruated. We got to figure out a way to say that's really simple.
I've tripped on it 3 times myself today, so you're good. You're good.
It's tough. But at any rate, clearly VWD is a big issue as well. But for us, we decided to do this focus on this community of women, and they have really made an impact as a result of that, both nationally and at the local level, and then really trying to assist with education as far as how to get appropriate treatment. So we were delighted to be a part of the summit, to be able to share our experiences, as well as looking toward the future. I have a granddaughter who has hemophilia. Her dad has severe hemophilia A, and so she is an obligate carrier or whatever we're going to come up with. and is affected. And so for me, it's personal as well as a professional concern. So that's why I was there.
Yeah, wonderful. We're so glad you were there. Nathan, how about you?
So I would say there were probably two primary reasons that I was there. The first and foremost is to help contribute to the medical and scientific discussions that were taking place, and providing some context for things like, why did we suggest certain things in the guidelines? Why did we address or not address a particular question? And for instance, a lot of that was mainly around constrained resources. We had more than 100 questions we wanted to ask as part of the guidelines, but we only had resources, time, availability, funding to be able to address a small subset. But as part of that, we also introduced a series of questions and research priorities at the end of every section of the guidelines. And a number of those particularly intersected with issues around WGPPM in the where should we go next? And so this was an important aspect for me of the implementation and the next step of the guidelines. We did all this work for the guidelines, but the guideline publication is just the beginning. And really, the vast majority of the work around the guidelines comes from actually implementing it and improving care. So I would say that was the first main reason. For me, the second main reason, I'm a cisgender man, so assigned male at birth. And I think it's important for me to be there as an ally to others in the community. I think I said during the summit, I may not have experienced a period, but I grew up with 3 older sisters. I'm the only boy of all the kids. And so, I was there as much being an advocate for the medical and scientific components as I was for individuals who deal with menstruation and childbirth and throughout their lives and undergo period stigma. And I think it's also important for us to just say the word period. I think it's important to hear people say that, and that it is not just women who are advocating on behalf of women, it is the entire bleeding disorders community. So that was another important aspect for me to participate.
Love that. Thank you so much. Let's take a moment and pause, and everybody at your own home computer, let's all just say it together. Ready? 1, 2, 3, period. Okay, we'll all get used to it. We'll start using it and not be shy about it. And that's one way we can all start to feel like we're doing something, talking about periods and overcoming that stigma. Love it. So thank you. I think that's really, Nikki, you want to chime in on something? Go ahead.
Oh, sorry. I pressed it by mistake, but I did want to mention, we did touch base on a few things that I want to talk about really briefly for the women that are listening. We did touch briefly on discussing birth control versus treatment, and how it is kind of the first line of discussion and kind of like the forcible line of treatment when we are having to face those issues with the menstrual cycles, or when we have to face those difficulty conversations of putting your child on an oral contraceptive or birth control at an early age, or versus does my treatment plan work better than an oral contraceptive or any other contraceptive for that matter. We did discuss that, and I just wanted to let our community know that that was a discussion that we had. And you can definitely take a look at that when that is available, so that no one thinks that we kind of just like forgot about that. Trust and believe, I'm a big advocate for that. But it is a tough discussion to have. And remember, every patient has a different treatment plan that works for them. But it is such a rough topic. It is hard to come by. I know personally, I went through several lines of treatment and found something that finally worked for me. But it doesn't mean that this is not something that shouldn't be missed, because oral contraceptives or birth control for that matter plays such a huge role for women who have the potential to menstruate, because it is kind of that big discussion that is had once you have your menstrual cycle versus having a bleeding disorder together with the with your menstrual cycle with a birth control versus a treatment plan. It is a huge discussion. So we did discuss that, and I hope you guys take away from what we discussed, and hopefully it helps you guys at home to guide that discussion with your physicians as well.
Yeah, thank you so much. And that's actually a great segue into my next question for each of you, which was what stood out to you as most important or the most important part of the summit? Because I know it's hard to pick one thing. And so obviously that was a standout for you, Nikki. Was there anything else that really stood out to you besides this conversation around hormone therapy, birth control? It's something we hear, very consistently around the struggle of that. And then that's only one type of bleeding that's addressing, right?
Right.
So was there any other areas, any parts of the summit that stood out to you?
I think the only other part that stood out mostly to me was just like, and I think this is a very big discussion, and I think Susan touched base on this too, and I believe Nathan as well, was the lack of resources. We talked a lot about this throughout the summit, but just because we have HTCs doesn't mean that the resources are available at the HTCs, and those of us who don't have the access to HTCs don't have those resources available at the HEMONC offices. So that was such a appeasing conversation because yeah, we talk about it every so often, but what do we do about it? Right. So now we have huge problems within the community, joint bleeds, women who have menstrual cycles, we have hemorrhagic bleeds. We have so many things that we have to discuss with living with a bleeding disorder, but what are we essentially doing about it? So that conversation definitely appealed to me. And I'm hoping that we can change that for the future.
Oh, yes, we had some good conversations about resources. I'm looking at you again, Nathan. I'll come to you next, but I was in one of the rooms where so many great ideas out there around, do we have separate international guidelines specific for WGPPM? Not necessarily that it's used often by bleeding disorder or by condition. And so just, really good conversation. There were not necessarily any right or wrong answers in these discussions, but just sort of like, the wonderful part about bringing all these folks together at the same table is people might be advocating for one thing and then learn, oh my gosh, that's how much it costs to do international global guidelines. I had no idea, but here's the change we need. What can we do then? If we don't think we can do that right now, what could we do to start to move the needle around, best practices and standards of care, right? So just that, it was that kind of conversation, but the resources were loud and clear within that for me, for sure. But Nathan, what stood out to you as one of the most important parts of the summit?
I think for me, one of the most important aspects was giving people an opportunity to share their stories. I was very impacted by it. And I think that it's one thing for me to be a physician taking care of my patients one-on-one in an exam room, in a hospital, and having that relationship and hearing what they're experiencing. But, we joke that the plural of anecdotes is not data. However, when you actually look at what we did in our summit, we generate a good bit of data through storytelling. And I was particularly impressed by the willingness of the participants to share quite detailed and sensitive information about their experiences with a room of people who had 24 hours prior been strangers. And so for me, I think that was the most important thing, to get people into a room, to have the conversations, to show others that they were not alone, that they were not the only ones who were experiencing what they were experiencing on a daily basis. And I think that it empowered a lot of people in that room to say, what can I do now? I've been living with this. I am an expert in this condition, and what can I do now? And I spoke with several of the other physicians who were present in the room from various centers, and we all said that it was validating to finally have people together collectively saying, this is what we need to do. And to your point about guidelines being expensive, yes, the VWD guidelines were a multi-million-dollar effort over 5 years worth of work and countless hours of people coming together. However, there are ways in which to take pieces of those guidelines and adapt it, or serve as an advocate for change. And do that work of actually going to a local HTC, or working with a third-party payer, or working with government and legislators to try to ensure that things like access to menstrual products are widely available. I think it was Michigan that's actually made it freely available. And, it is really a great opportunity to have everybody in the room collectively realizing I'm not alone and we have strength in numbers.
Love that. Love the strength in numbers. How about you, Sue? What are some of the parts that stood out to you as most important?
I would agree with Nathan. Uh, Hearing folks tell their stories and be so vulnerable with everyone. And I think that demonstrates how much people need to share and be able to express the issues and challenges they've been living with that maybe weren't heard before. And I think that made a huge impact, along with, I think it was really great to have the physicians there. We had Mira Chitler and Angela Wyan, who I work with closely, who've done a lot of really wonderful things and are expanding what they're doing. But I think one of the things that came that I don't know how we're going to do this is it became clear that there's huge need and there's so many of us working on various pieces, as you said earlier. And how do we figure this out? How do we divide and conquer? And that was something that hit me hard, I think, with the whole thing. Like, now where do we go? We've got people working on these various areas, but how do we come together? And we talked a lot about that too. And how do we do it in a way so that we're not duplicating effort, but collaborating? And that's really tough when you're trying to do something this significant across the country and potentially across the world. So
Absolutely. Absolutely. I think that's the work ahead that is challenging, but it felt like, to both of your points, like the momentum in the room was there to
yeah, for
continue that
sure.
on. And I know that's what a lot of people are wondering about. So like, what now? What next? Again, you guys are like plants. This is a perfect segue into my next question here about, have you done anything since the summit, that was impacted by the summit? Did you take any actions? Have you made any changes to the work that you do, to your own advocacy, whatever it may be? And let's see, Nathan, I'll toss this one to you first.
So I think the biggest thing that I've done since leaving the summit was being very thoughtful about my discussion in teaching. And so I've done teaching for our hematology fellows here at Brigham and Women's and Mass General Hospital. I've also participated in a few other talks along the way where it was very focused on the impact of menstruation and things like also the importance of including transgender individuals in hematology research. And so I did a talk at the ISTH meeting this summer and wove in some of the information from the summit and giving people a heads up that, the white paper was going to be coming, talking about a lot of these issues. I think that the other kind of aspect is thinking about where do we go with clinical studies. So I just got back from the American Society of Hematology meeting, which was in San Diego over the weekend and the earlier part of this week. And as part of that, I was lucky enough to have some meetings with companies that are developing therapeutics that affect a wide range of bleeding disorder diagnoses. And along the way was having a conversation with them saying, it's really important that you include specific outcome measures around menstruation. And there's a project that I think the NBDF is helping support, looking at core outcomes for people with VWD in clinical trials. And this is going to then be and say, this is the minimum that you need to include. And in there is a subset related to that. I don't want to share more information than I'm allowed to at this point because it's going to go up for publication. But I can confidently say there are a number of outcomes in there related to the impact and outcomes around menstruation and postpartum hemorrhage. So I think those are really important aspects that have been there that I've been able to take directly from this summit and share stories.
That's wonderful. Wonderful updates. Thanks so much. Nikki, how about you? Have you been able to take any steps since the summit that you feel like was impacted by what you learned or shared there?
Yeah, so I'm always a work in progress. So I'm still in the works of my own progress. I had some stuff personally that I had to take care of after our meeting. So my steps were a little bit different. For those who don't know, I do have a daughter. She was born in 2020 at the peak of the pandemic, and she was found to have von Willebrand disease as well, type 1. So my steps I took were in regards to her. So I was told that in her future, she would require medication when her menstrual cycle comes. Well, I decided to take this summit into my own hands, let alone my own education around von Willebrand and living with it. And I said, well, let's take the steps now, because when her menstrual cycle comes, I don't want to wait for that time to come. And let's not wait for her to have the worst experience. Let's be prepared. And so now we're taking those steps to be prepared for her menstrual cycle. Even though I have a long time, it doesn't mean that I cannot be prepared, because she still has a long time to go through her diagnosis, the multiple testings, just like medication trials, all those things that she has to do. But instead of being told to wait until she has her menstrual cycle, I have taken the steps to initiate her treatment plans, or just to initiate a health care plan in general for her von Willebrand, to start school, to just be ready, because nowadays menstrual cycles are starting as early as 10 years old, sometimes not. So I'm getting ready. I took this summit to be ready for my daughter. And hopefully when I'm ready, to make my step, I will initiate this summit as well for my future. And for those I'm always going to advocate for other women as well. But right now I am having to advocate for myself and my daughter, and I'm going to take those steps, and Nathan is going to be right by my side.
Love that.
So
Love
yeah.
that. Good. Well, good luck in that process. And I mean, I think that's why we have you all here. Everybody's taking these different steps already, and what can we all start to do together? But Sue, let me hand it over to you. Have you all individually or at the foundation been able to take any steps?
We did. Actually, folks that attended the summit, we reached out to several folks to see if they were interested in coming to our conference in October. And we also have now added a kind of a DEI element to our invitation to folks, to make sure that everyone who has the potential or has had the potential to menstruate and is living with hemophilia or a very rare factor deficiency felt welcome to attend. And so we did have folks that we met at the summit, and my colleague Sherry Lucky, who is living with bleeding disorders herself, multiple disorders as well as her whole family, she really took a lot of information to heart, and we looked at a lot of the topic areas and made sure we had things covered in our conference this year. And we had Amy Dunn from the chair of the Medical and Scientific Advisory Council as part of NBDF, talked about the guidelines that the MASAC is putting together. And we did a session on how our community members can utilize those guidelines when they are going to see their HTC. A lot of HTCs are fabulous. I work with a lot of fabulous HTCs, but not everybody is Dr. Nathan O'Connell here. I mean, a lot of folks still struggle with understanding how women can be affected. So we did a lot of advocacy work with the participants, and that a lot of that was really encouraged through hearing people's stories and understanding the need to encourage folks to look for providers who can be and will be supportive as they're determining what kind of care they need. So and we had Lynn Malik and Angela Wyan talked about a program that they're in the process of building for women, as well as Jill Johnson and Dr. Sidonio. So we're trying to get these folks to come together, and they're trying to figure it all out too. So there's a lot happening, which is really exciting. It's just a matter of then, how do we accomplish, back to that, how do we accomplish it all? It's really tough.
Right.
So
yeah,
anyway.
absolutely. That's wonderful progress. Thank you so much for sharing. What you all heard today was 3 people their progress and what they've been doing, right? I mean, we had 50 people at the event. We had various organizations represented. So there's so much more that is already happening. And those are only the folks that were at the event. We know the community at large has been moving and shaking on a lot of this. So from my perspective, from NBDF, we had some of the pieces pulled into our bleeding disorders conference and some of our women's track sessions at BDC this year. We have more coming at BDC 2024, so definitely join us there. But we also were able to get this white paper launched and all of the materials online. So opening up this open comment period is really one of the key pieces we're focused on right now to get these additional voices. And then we really want to start to think about, after we get all the rest of that feedback, really look at priorities as then have some of that follow-up. Those are some of our next steps. How do we stay connected, to your point, Sue? How do we coordinate? We don't all have to be doing the same thing, but let's stay in touch on it. Let's coordinate. There's a lot of efforts that are happening even in that arena. So how do we make sure all of the pieces are together? That's some of the stuff we're interested in this coming year, as well as all the work that we're doing through different various programs, from treatment and care to diagnosis for WGPPM. So to your point, a lot to come, but I think we're just in this journey together, which I'm loving to hear from everyone. So with that, I do have one last question, then we're going to open it up to full questions from the audience, but I'm going to screen share one last time. Okay, my final question is, for our panelists, did any of these stand out to you of our priorities, or one or two that are the most, connected for you, the thing you want to work on next? Like what are your takeaways from these, if you had to pick one or two that you would want to really dive into or hope the community dives into? And let's see, Nikki, you're nodding, so I'm gonna go to you first.
Yeah, so I was going to say, being a woman and living with this situation, it is very hard to feel like you are a little piece of a puzzle that is being put together by other people. And I can understand how it's so easy to be felt like you needed to be silenced. And I don't want anyone to feel that way. And I can understand, because I've been there before, and I hope that this summit, and let alone anything that we can do in this community, can uplift women to speak in regards to living with their, potential to menstruate. But for me, it would be creating a clear path to diagnosis, because specifically for von Willebrand disease, not omitting the other bleeding disorders, but it is a difficult diagnosis. No matter what level it is, living with it is difficult, and diagnosing it is difficult. So I would say that for me, and of course, improving awareness and education, because I'm not ashamed to say it, but I was just in the hospital and I just got out, and I was there for 4 days, and I had a hematologist tell me to my face that women cannot have hemophilia. And so that alone, it shows that there's still room for education. So that would be something for me.
And we're going to get you a copy of the white paper to hand to this person next time, right? I like it.
Yeah. So
but you're absolutely right. It happens too much. Absolutely. Thank you so much. Sue, back to you. Which of these are you most jazzed about?
Well, I'd have to agree with Nikki. I think that improving awareness and education across various audiences is a top priority. And through, medical school education, et cetera, it's tough because a lot of hematologists, it's just not really taught. They don't really understand. And we often hear about situations like yours, Nikki, where they're arguing with you about your bleeding disorder. And so that requires a lot of personal advocacy and empowerment, which can be difficult, particularly when you're not feeling the best. So that's one area I think is really important, as well as the ensuring access to appropriate treatment, which I think goes right along with creating a clear path to diagnosis. Actually, they're all, I could go across all the circle, but those two, those two mean a lot. And I think the research gaps is another piece, but it's tough because Because sometimes I'll hear that research was made available and people didn't, participate. And I think figuring out how to more effectively share when those opportunities are available, and how people can access it if it's at a center that's too far away, or all that kind of stuff. So lots of interesting opportunities, but those three I think would be terrific.
Wonderful. Thank you. How about you, Nathan?
So I think it's tough. It's like saying you love all your children equally, but do you
Pick which one? No, I hear you. I hear you.
And I know, and I do have some that I think particularly struck out at me. Filling research gaps is so important as a clinician scientist, knowing that what we have to do has to be data driven. But I think it's important to say, do we need more research to say there are disparities? We already know there are disparities. The question is, what we need is more research on trying to address the disparities and therefore showing what actually will work to move things forward. So I think filling research gaps is important. I'm also the self-advocacy piece I have always had mixed feelings about, because again, to Nikki's point, Nikki's a great self-advocate. But I think that a lot of patients don't feel that way. And I think that even though we do need to work on healthcare provider education across multiple specialties, I think a lot of this starts with an individual. Michelle Scholzberg was quoted as saying that in hemophilia, you're born with a right to prophylaxis. In VWD, we make you suffer and earn it. And I think that is really something to speak to how everybody approaches prophylaxis. And I can say that I know of several individuals who advocated for themselves with guidelines, with evidence, with studies that had come out and said to their HTC, and then having to help their HTC fight to get access to prophy for their frequent nosebleeds and their frequent, the heavy menstrual bleeding they were experiencing. So for me, I think, strong self-advocacy really ties into every other piece on here. And it recenters the focus back on the lived experience expert, as opposed to all of us that are in the community supporting them.
Wonderful. Well, thank you so much. I'm going to stop my share here. I will, we transition here to see if there's any questions from the audience. I do just want to say that, we are so appreciative of all of you being on. You sort of represented a few of the types of, participants that we were able to have at our summit. One group that wasn't here in person on this webinar was our industry partners. So I do want to thank Genentech, Novo Nordisk, Pfizer, Sanofi, and Takeda for sponsoring this event, but not just sponsoring it. They were participants. Their representatives came and worked in the working groups, right? Because they're stakeholders that can help move this agenda forward, right? And so we wanted to make sure that, hey, let's understand the barriers there, right? Let's make sure we're understanding that perspective to see how we can better collaborate. So I do want to truly thank those sponsors, as well as just every participant that was at the summit, and all of you who will soon be taking the little survey that we have for open comments to contribute to this even more so we can move forward together. And with that, Fiona, I'll hand it back to you.
Great. Thank you very much. Thank you, Kate, Nikki, Sue, and Nathan, for this really an interesting presentation and I think an even more interesting discussion about just some of the aspects that the summit has brought to light. Just wanted to mention quickly again to our audience, Kate invited you to read the summit white paper and to provide comments on it. We've dropped the link to that into the chat. So if you go to the chat option at the bottom of your screen somewhere there, you should find a little link that you can save somewhere, maybe bookmark on your browser. Go and take a look, read through it, leave your thoughts there before January 31st. The open comment period is open through to January 31st, if I'm not mistaken, Kate.
Correct.
Excellent. So I will try and bring you in some questions now. We've got just a few minutes left. And you know what I think I might do is just try and share with you some of the feedback we've been getting on Facebook, because we've actually had a fair bit of comments just coming in on Facebook. And I'm just going to read some of them because they really resonate with some of the things that you've been saying, all of you. We've got one individual who's saying that my first period was at age 9. Because I was so young, I had no idea what was happening. It took months of fighting to get treatment for my month-long periods as a scared little girl. Thank you all for doing this. So I think that really resonates with what you're talking about in terms of the self-advocacy and the need to educate, so that a 9-year-old is not having to explain to a hematologist that something is wrong. Another comment was asking about, how can we get factor covered 100% by insurance and not have to worry about the cost or have to seek funds from outside sources? So there's another one of these barriers to getting the treatment that people need. Someone here is saying that they've lost track of how many doctors and nurses and other medical professionals have argued with me about women having hemophilia, and they all say that women just cannot. Her son went to see his doctor and mentioned ideas about had a feeling that hemophilia, and his doctor argued with him. So she wants to really try and help to spread information to healthcare professionals about women and bleeding disorders. It would help really, I think she's suggesting at the level of, for example, nursing students, to be able to educate them better. So I think the idea of kind of educating at all levels and integrating this into the training of all healthcare professionals. And so this is really, really strong comments coming from the community. They're really in support of everything that you're saying and exemplifying it. And I think just also there's a lot of frustration, that this is the case now. And I know some of us worked on the State of the Science Research Summit, looking at issues for women and girls and people with the potential to menstruate, and identified a lot of the same issues. So I think it's really exciting to see that there is now a roadmap, a way to move forward. You've done a lot of work on this, and I really hope that people will come and contribute their comments to keep moving it forward. As we are coming up on the end of our time, I think we're going to leave it there in terms of a Q&A. I think that the response...
Can I just add one really quick thing?
Sure.
Obviously, we need to get out there and do this healthcare provider education in various different types of settings. And I just want to say that this is something that a lot of the organizations are doing. And so we just need to do more of it and, be able to reach even more folks, but absolutely. And, from a personal advocacy perspective on it, I think, Sue, you mentioned it, but going to hemophilia.org and getting the MASAC guidelines. There's 2 different sets of guidelines specific to WGPPM, and being able to share those with healthcare providers that are resisting. Because then it's like, provider speak to provider speak. You don't have to necessarily take my word for it as a patient, but these are the guidelines that are recommended by the expert clinicians in our community. And those, not guidelines, recommendations. And so those are the kinds of things that can be a baby step in the interim that we all can do. And anytime we face somebody, be it, if I don't have a bleeding disorder, but if I'm at my OBGYN and that would come up, absolutely, I'd be like, I'm going to send you something afterwards. I've done it with my dentist, right? So all of us can take little steps starting right now.
And perhaps, if individuals are not already associated with their local chapter of NBDF, and if they're feeling a bit, alone in their efforts to educate and to advocate, that's also maybe a step that they can take, is find their local chapter and find other people, because a lot of this work, as you say, is going on at a lot of different levels, and it must be a very difficult thing to try to do as an individual. So
you can always reach out to us, and we will happily connect you to the right folks.
Perfect. Excellent. So I'm just going to do a quick little wrap up. Thank you, everybody, for being here. I really appreciate all of you lending your expertise and your time today. It's clearly something that is really of great importance to our community, and that a lot of people want to know a lot more about. This recorded webinar will be available on Friday, December 15th at hemophilia.org under the events tab. If you select past events, you'll find all of our archived webinars there. Also available in the events tab is the schedule of upcoming webinars in this series. Join us next week for the last Wednesday webinar of the year. And in this webinar, Dr. Amy Shapiro will tell us about advancements in bleeding disorders care. Thank you all so much for joining us this afternoon, and have an excellent week.